So in the manual describing the implementation of motivational interviewing in Native American communities, these are some of the things they say. That motivation for change honors the wisdom within the client instead of trying to force the therapist's wisdom upon the client. The client is seen as a person rather than a problem. The client identifies and processes his or her own feelings about change. And specifically, some tribes take this to the level of respect to new heights and call clients by their clan relations, such as sister, uncle, etc. The counselor provides humble, respectful, and active guidance in helping the client examine and forward with their feelings about change. Persuasion is not an effective method because trying to convince people to change often invites them to argue against it. So it really deals with some of the what people of color often get labeled with in therapy, which is the resistance issues. In the motivational interview, we eschew that label and talk about the internal struggle for change and the ambivalence that's there. Counseling style is peaceful, draws wisdom out from the inside of the client, recognize that readiness to change is unsteady, form the therapeutic relationship as a partnership rather than as an expert talking to a patient. And this manual is in the public domain, and so it's available. You can Google that stuff and you find it. And a very nice example of a cultural adaptation that perfectly adheres to the original evidence-based practice. And so just some of the practices that are, again, look kind of linear and Western, but are actually nice ways of addressing some of the tensions that arise in intercultural encounters that happen in therapy are things just like using a readiness ruler and actually gauging the importance that a client holds for their current behavior or the reluctance they have to change the behavior. And so that's a nice practice embedded within motivational interviewing. And then another nice, very linear draw, like 4 boxes on a piece of paper kind of intervention that ends up being both the deciding, it's the factor that's most associated with successful motivational interviewing, which is just exploring ambivalence with the client, right? What are the advantages of things staying just the way they are now? What are the disadvantages of things staying the same? What are the advantages of changing? What are the disadvantages of changing? Are very straightforward questions, though, that get at some of what might traditionally be stumbling blocks in cross-cultural adaptation, which is the things you're asking me to do may be violating deeply held values and traditions that I hold. And so I need a little more work on why would I do this? Why would I make this change? And what would it cost me to make this change? And that's in the spirit of motivational interviewing. So I think that it's a, first of all, for problems like health behavior change, substance use, it's being used in agencies for childhood obesity, that interventions that are using this practice are ones that will be particularly effective, I believe, from the evidence and from the content of the practice in engaging ethnic minority clients. Oops, slide backwards. Right, so let me give you a specific intervention that uses engagement practices designed to treat ethnic minority populations, and then I'll give you a case example to finish up. And so the work I do with public behavioral health and justice policy at the University of Washington is involving implementation of a multi-systemic therapy and a specification of multi-systemic therapy called family integrated transitions. Now we have the benefit in implementing this evidence-based practice that the development of the intervention itself was done primarily in communities of color. The largest samples, because of the disproportionality, mostly that I showed you earlier, the largest samples in the development of multi-systemic therapy were in African American populations, and then there have been large replications in Hispanic, Pacific Islander populations as well. And so that there are some evidence-based practices that meet that standard, but again, it's relatively specific, and in the general universe of evidence-based practices, it's relatively rare. But partly in our implementation of multisystemic therapy, we think of four basic overarching principles around cultural competence, and some of these I've talked about already, but that the interventions are designed to empower families to intervene in multiple systems, including ones that may be perceived as coercive or punitive. So one of the principles in this specific intervention in multisystemic therapy is primarily implemented for kids in juvenile justice, but there are also implementations for kids with psychiatric illnesses that would put them at risk of being placed out of the home, and there are implementations for significant health problems like diabetes in adolescents as well. And so the idea in this intervention is that you're empowering families to intervene in systems, but recognizing that systems, again, often mean something punitive or coercive in communities of color that we, as part of those systems, can fail to recognize. And so there's nothing like the sense of isolation sitting at a school meeting to talk about all of the problems with your child's behavior, sitting at the head of the table surrounded by 12 or 15 white people when you're an African-American person, right? So that's a very different experience than we as providers might have sitting at the head of the table. These are our friends. These are people we work with all the time. We're really good at talking about individual education plans and behavior change and what people should do. But if you think about it from the other perspective, we have to be prepared to walk alongside clients and be there supporting them, not as supporters of the system, which we're experts in. And so that's one of the things we do in multisystemic therapy. One of the things we haven't talked about in terms of evidence-based practices is things that people don't like to hear, but cultural matching can be helpful in many interventions, right? It doesn't necessarily predict outcomes, but cultural matching predicts engagement. So cultural matching plus an evidence-based practice predicts engagement and outcomes, right? And so there's room for that, but of course that's not always in our control. I don't have a transgender Peruvian therapist to refer my client to. I have to figure out how to do this myself. So I have to be culturally competent, right? Even when I'm not matched. Then we talked about the respect of culture, which we've been talking about today, and cultural strengths as keys to change and development change. You know, I tell my students this, culture is not axis 6. Culture is not a problem. Culture is a strength. Culture is what you're going to use. Culture is what's going to ultimately solve this problem. It's not in your way, right? You may have a dismal failure if you cannot harness it. You cannot use the strength of culture, what people carry with them, their sense of who they are and where they've come from is the most powerful thing we have, right? Predicts more of the variance probably than the content of the evidence-based practice. I may have trouble saying that. Another thing about multisystemic therapy is it's simply, here's this little social work, this will be very popular, it's social and ecological in nature. It's not individual and psychopathology based. It recognizes that the individual's embedded in systems that impact their behavior and they impact those systems. And so our interventions in multisystemic therapy rely on that. And in some ways it becomes, again, an inherently culturally competent intervention. You can still mess it up, but you're on your way to being culturally competent when you recognize that the neighborhood and the community and families impact the way people behave. As opposed to sit down and you and I are going to work out how you're going to solve your problems yourself, which is the most culturally competent thing to do. So you can look back at some of these. I have to move on. Some of the other things in an intervention like multisystemic therapy are just that engagement is embedded. Remember I said I like interventions where the engagement is embedded in the intervention, and so it is in this one. The treatment team is responsible for engagement, provide services unconditionally. Right? Now, think about that as a cultural competent practice. You cannot be kicked out of our treatment for having the problems for which you came in. You laugh, but people get, I get a phone call of kicking your client out of anger management. Why? Too angry. Kicking your client out of substance use treatment. Why? Using too much substance. Right? So those are realities, and if you have treatments that can be unconditional, and that's a very difficult thing to be, you're well anyway. We talked about strength focus, we talked about the empowerment of family members, comprehensive services provided in an ecology are priceless in becoming going to people's homes